So I think now living in 2026, we have been using single agent maintenance with mainly with lenalidomide for years and years and years. And all phases of treatment in multiple myeloma have gone from 1 to 2 to 3 or even 4 agents together, the quadruplets. So why would we continue to do this for maintenance as well? There are alternatives now, for example, combining lenalidomide with Daratumumab or other agents, carfilzomib. And I think these have been explored now in a couple of clinical trials, including the IsKia trial and the PERSEUS trial. And we have seen that lenalidomide plus Daratumumab produces a much higher rate of MRD negativity and also sustained MRD negativity. And this seems to be associated with a better PFS as well. It's maybe a bit early to give a final judgment about that, but data as they are now, they look promising, and I think the combination of daratumumab plus lenalidomide will be at least one of the standards for future maintenance regimens in multiple myeloma.